Well, it's open enrollment season once again, and when Americans are asked to enroll in the health insurance plan. Here to tell us about and to sort through the sometimes rather confusing process is Dr. Frida Lewis Hall from New York City this morning. Good morning, doctor.
Good morning. How are you?
I'm doing wonderful, feeling healthy this morning. But tell me, so many people get frustrated every year when they have to go back and re-enroll into their program. Why do they have to do that?
So it is so very important, and I know that for many people it is a challenge, but it's so important to take a look at your options every open enrollment season because your plan may change year to year and your health care needs may change year to year.
And I'll tell you what, you've got a formula that is so important to look into the medications or the medicines that are covered under your plan, my plan. What do we need to look for with that? Because some medicines may not be included in that plan, some additional medicines, and some may just be generic, and maybe some of us don't want generic, right?
That's correct. So I say to people, you should start choosing your health care plan by understanding what your health care needs are. Sit down for a minute. Think about how you use your health care plan. What doctors do you see? What prescription medicines are you on? And then think a little bit in the future if you can. What might I be needing in the coming year? Is this the year I'm going to have that hip replaced? Have I just been diagnosed with a chronic illness where I may need to change my medicines? So take that list and look at the formularies. That's a fancy name for the list of medicines that are covered by various plans, and see if the plans that you're considering cover your medicine. And sometimes that information is available on their websites. Sometimes you need to give them a call and ask.
And formularies, I like that word. That's a really cool word to be looking at with putting together what plan is best for you. Let's talk about copays, because copays can just really eat away at maybe some of your savings, maybe some of your monthly income.
Well, it's so important to look at not just premiums or deductibles, but how much money you'll actually pay out of pocket for things like doctor's visits, laboratory tests, and as you just mentioned, how much you might have to pay when you get to the pharmacy in the form of a copay to pick up your medicine. And that's why it's so important to know what's on the formulary. If a medicine is on the formulary, you may have one copay. If it's not on the formulary, the cost for you for that medicine may be much, much higher. So it's important for you to understand which plan offers the best options for you when it comes to your prescription medicines.
Tell us real quick, we've got just a few seconds left. What support does Pfizer provide its patients having trouble maybe paying for medicines?
So Pfizer understands how challenging it is sometimes for people to pay for their medications. So we have a program that offers about 40 of our medications for free to people who meet 4 times the federal poverty level. So that's medicine that would be provided for free. But if you're not eligible for that program, we don't stop there. We also offer assistance, substantial discounts to patients who do not have insurance, copay support to patients who do have insurance but may not be able to cover for their medicines. And even in some circumstances, we're able to help patients choose a plan around specific Pfizer medicines that would be helpful for them.
It's always to know that Pfizer is always helping out the Americans that are out there. Thank you so very much, Doctor. We appreciate you joining us today from New York City.
Thank you.
And we've got more Lowcountry Live in just a few moments. Stay with us.